we'll touch on the importance of accessible and equal healthcare for Indigenous Australians and how historical policies and errors continue to affect First Peoples' health. The White Australia policy is a policy and error in Australian history that changed the lives of both Indigenous Australians in that era and still impacts them to this day. Furthermore, hypertension, a common disease in First Peoples, will be discussed. The correlation between White People Australia policy and hypertension will be analysed and discussed. And finally, healthcare relationships and their importance to the accessibility of healthcare for First People will be discussed at an individual, community and institutional level. The White Australia policy. Throughout history, there are certain errors that have impacted and shaped society. The White Australia policy era that took place during the 1850s to 1973 had a significant impact on First Peoples. The White Australia policy, also known as the Immigration Restriction Act 1901, was a historical legislation implemented in the aim to stop non-European immigration into Australia. The effects of the White Australia policy significantly impacted First Peoples during this era and continues to impact them in modern society. During the time of colonisation, British colonisers were considered settlers, whereas Indigenous Australians were referred to as the dying race. Consequently, First Peoples were seen as immigrants, and in order to remain in their own country, government legislation required them to provide a 50-word written letter in any European language. A significant number of applicants would not pass the test as English was not spoken by Indigenous Australians. In the view of immigration officers, these applicants were from undesirable countries or were seen as morally unfit. The National Museum of Australia stated that before 1909, the test was conducted 1,359 times, with a success rate of 52 applicants, who were accepted entry into Australia. The Australian government ensured entry into Australia was limited, and therefore failure of this test resulted in deportations by the Australian government. Indigenous Australians were forced to migrate within Australia away from their traditional lands and way of living, impacting their connection to country and the land. The government in power at the time encouraged migration from Britain in the aim to increase eligibility within the workforce. This led to First Peoples having limited opportunities to jobs and suffering financially. Loss of income had negative effects on families and consequently impacted individuals' access to basic human necessities such as food, water, and healthcare. Hypertension, also known as high or raised blood pressure, is the condition in which blood vessels have persistently raised pressure. Blood pressure is created by the force of blood pushing against the walls of blood vessels as it is pumped by the heart. The higher the pressure, the harder the heart has to pump. Hypertension is defined as a systolic blood pressure greater than 140 and/or diastolic pressure greater than 90. Hypertension is a serious condition and can increase the risk of stroke, coronary heart disease, heart failure, and kidney disease. Major risk factors for hypertension include increasing age, family history, poor diet, and obesity. A number of these risk factors are more prevalent among Indigenous Australians. Reducing the prevalence of high blood pressure is one of the most important means of reducing serious circulatory diseases, which are among the leading causes of death for Indigenous Australians. The 2011 Australian Burden of Disease study reported that high blood pressure was among 5 risk factors that cause the most disease burden for Indigenous Australians. High blood pressure accounted for 8% of the health gap between Indigenous and non-Indigenous Australians. The rates of hypertension were higher for Indigenous Australians across all age groups compared to non-Indigenous Australians. Furthermore, in 2018, the National Aboriginal and Torres Strait Islander Health connected both measured blood pressure and self-reported blood pressure. Based on both measured and self-reported data, 31% of Indigenous adults were estimated to have high blood pressure. Evidently, it is clear that while hypertension is a worldwide issue, Indigenous Australians are at a higher risk of developing hypertension, the reasons for which will be discussed later in this presentation. The White Australia policy, along with its segregating assimilation approach, continues to play a substantial role in the outcome of Indigenous people's health today. Through white superiority, stolen children, forced rural living, and minority grouping, the White Australia policy has played a major role in largely disadvantaging Indigenous Australians' social determinants of health. The institutional racism that has occurred as a result of this policy plays a significant role in the way Indigenous Australians have been considered for medical education, funding regimes, health policy, and clinical settings. Furthermore, inequities of education, employment, income, and poorer housing quality are among the contributing reasons as to why Indigenous Australians face larger health risk factors in comparison to non-Indigenous Australians. These risk factors include being more likely to participate in risky behaviours such as smoking and excessive alcohol use, become diagnosed with obesity, diabetes, and psychological distress, and are consequently 23% more likely to be diagnosed with hypertension in their lifetime. The White Australia policy forced Indigenous Australians to leave their reserves due to government housing and mining, resulting in living in significant distances from essential community and healthcare services. Approximately 65% of Indigenous people still live rural and regional, which largely affects the access to appropriate health services. In order to be diagnosed and therefore treated for hypertension, a healthcare provider must measure 3 high readings of blood pressure across different appointments. This is why many Indigenous Australians live undiagnosed and untreated for years due to not having adequate access to healthcare services within their remote locations. Lack of access to healthcare services goes beyond merely location for Indigenous Australians. The White Australia policy was tied to the establishment of many medical institutions within Australia, meaning healthcare provision for Indigenous Australians was nowhere near the standardised level of care in comparison to non-Indigenous Australians. The impact of this policy still plays a role in Australia's healthcare system, with institutional racial discrimination majorly contributing to the health gap between First Peoples and non-Indigenous Australians. Although today this may be seen as unconscious bias rather than overt discrimination and racism, the poor health outcomes of First Peoples are still heavily reported as a result of this. Many Indigenous Australians associate negativity with health services and are therefore faced with discomfort, cultural exclusion, and fear within the healthcare system. This is particularly prevalent within hypertension amongst Indigenous Australians. In the 2018 census, an estimated 75% of First Peoples had a high blood pressure recorded and had not reported this to be the case. Reasons for this can be attributed to the lack of safe and culturally appropriate access to healthcare, whereby Indigenous Australians do not feel comfortable visiting a healthcare service. Relationships in healthcare are key to providing accessibility and equitable healthcare to First Peoples. These relationships can be split into individual, community, and institutional. Interpersonal racism as well as generational trauma can cause high psychological distress in First Peoples. Traditional views of a health professional as the expert and the client merely bringing disease to the table can hinder a healthcare worker from providing the support required. It also discourages First People from attending health services as they feel they cannot express their values or needs, limiting their voices from being heard in the decision-making processes that impact their lives. Furthermore, the condition for Indigenous identification, due to definition and ethnocentrism, diminishes, disempowers, and demeans the cultural identity of First Peoples. There is a background of fear, mistrust, and uncertainty when it comes to the First People accessing healthcare and dealing with non-Indigenous peoples. This is due to a fear of racism, disrespect, judgment, and government involvement. Healthcare professionals need to be trained in the intricacies of the First Peoples and their history. They must also be aware of their own biases and prejudice when working with First People in order to achieve best possible outcomes for these patients. These biases and prejudices can be rooted in the history of Australia and its mistreatment of First Nations people. This results in First Peoples not seeking medical help, often resulting in further medical complications, fear of government institutions due to the long-standing history of government policies that negatively affected First Peoples also result in them not seeking medical help. Finally, miscommunication between healthcare workers and First Peoples is detrimental to the First Peoples' health outcomes. Language barriers, for example, nonverbal such as direct eye contact, is seen as Western society represents respect, but in many First Peoples culture it represents disrespect. These communicative habits of Western society can leave First Peoples feeling disrespected and unheard. In the National Aboriginal Health Strategy, First People defined health as social, emotional, and cultural well-being of the whole community in which each individual is able to achieve their full potential as a human being, thereby bringing about total well-being of their community. This conceptualism of health is largely contrasted by the dominant health model used in Australia today, the Western biomedical approach. Specifically, understanding by health professionals is largely on Western constructs and understanding of cultural and linguistic diverse backgrounds is marginalized. Thus, health service delivery in terms of health promotion, education, and prevention of illness is not always appropriate. Statistics found that First People health is often better in remote areas than central communities due to their level of control, whereas the Western biomedical approach doesn't provide the health that First Peoples require. Terranolians deemed that Australia was uninhabited and thus colonisation began, resulting in government intrusion and management over lives of the First People since first contact, resulting in decimation of Indigenous land and food resources, change in diet and physical effort, a loss of knowledge on medicinal properties of plants, and marginalised ability to care for the community. At the moment, it is us in positions of power of how we think their community should be treated. It should be people from the community in power, and we should be working as an interprofessional team with the said person to help them achieve what they perceive they need. Racism can be defined as requirements, conditions, practices, or policies that maintain and reproduce avoidable and unfair inequalities across ethnic groups. The gradual eviction of First Peoples throughout history of Australia has led to a fundamental white privilege superiority in institutions. The way our healthcare system works don't allow First Peoples the ability to express their cultural expressions in how health and healthcare can and should be practiced. This is due to limited representation in health services, laws, and regulations, plus limited First Peoples workforce in delivery of care. Furthermore, due to lack of incorporation of First Peoples culture in the design of Australian healthcare services, Indigenous knowledge, perspectives, and cultural practice is silenced. First Peoples experience widespread inequality and discrimination as a result of complex policies and systems that were established in a historic environment of white dominance. In modern healthcare, the role of cultural liaison and community-controlled health services have been established in an attempt to close the gap between healthcare accessibility and health outcomes. However, offering separate primary services and supports for First Peoples does not redress the discriminatory practices occurring in mainstream health services and could be identified as segregation. Additionally, the Great Chain of Theory being indicates that history has hierarchical order of white-skinned people at the top and control. This has founded a long-standing fear of authority figures. This prevents First Peoples from feeling comfortable presenting themselves to mainstream services. To conclude, it is clear that history has a direct impact on current health concerns of First Peoples, and the White Australia policy is only one of many policies and errors that had such a detrimental effect. The segregation caused by the White Australia policy led to the lack of access and equality of health services to First People. Hypertension is very prevalent in Indigenous Australians. However, due to the after effects of the White Australia policy, not only is access to healthcare limited for First Peoples, it is also fundamentally racist, and thus Indigenous Australians don't always feel comfortable accessing care. The subtle segregation, marginalised perspectives, and limited integration of ideas and Western privilege that is what creates a mistrust between First Peoples and healthcare. It is easy to trust someone and lose that trust. However, it is very difficult to mistrust someone and then trust them. Thank you.